Hey, sorry about the technical difficulties. You know, when you're going live, that just happens. But thanks for hanging in there with us. I've got Rory back, going to help me talk about. Oh, I'm getting the winner. So, Glenda R., you won the Hydrofacial. Is that right, Glenda R.? I've got so many smart people helping me today. It's awesome. And again, that's what we need here at SKINovative. We have a great team. So, love it. So, Sarah talked a little bit about PRP, platelet-rich plasma, and she said a little bit, platelet-rich plasma has lots of growth factors. And so if you have growth factors, you can use it for lots of different things. And it's been used for many years in medicine. We've actually brought the benefits of PRP into our practice. And so the first one that I'm going to talk about is PRP hair restoration. And the first question I get is when you look at me, you say, well, Dr. Fulton, if it works so great, what happened to you? And I say, well, there's certain questions that Rory and I both ask. And one of those questions is, how long have you been losing your hair? If you've been losing your hair longer than 10 years, probably not going to be the right treatment option for you. And so I have men that come in that look like me, and we talk about the draft. In fact, the NFL draft is on tonight for all you wives that are interested in that, or men. But not a good candidate. But if you haven't been losing your hair for a long time and you still have a good amount of hair and you aren't on any bad medicines, then PRP hair treatment is awesome. And we've treated hundreds of patients. It works great. There is one medicine that might be important for you to remember in the future. There is a medicine that some people take that makes using PRP for hair treatment a little bit harder, and that's testosterone. And the reason for that is testosterone often gets converted into that DHT, which we hear a lot about. And so if you're on testosterone, it's going to decrease the effectiveness of PRP. So don't forget that. All right, Rory, tell me about the PRP O shot.
So in addition to doing facial rejuvenation and hair restoration, we have female rejuvenation. And so this is where we can do a couple injections. Again, we're using your PRP, and treatments like increasing sensation, stress urinary incontinence. So if you're jump roping, maybe a sneeze here and there, that can help with that as well. Again, we're just kind of rejuvenating some of those cells, increasing blood flow. It's a lot of good beneficial things you can use.
Yeah, that's awesome. So one of the things I think about, if we're doing that treatment, that's got to hurt, right? Does that hurt, Rory?
You'd be surprised. It's actually pretty comfortable. And we do topical numbing, but that's really all anybody needs.
So topical numbing, about 10 or 15 minutes, and then the treatment. Yeah. Is that a kind of a one-and-done treatment, or what do you recommend for the O shot?
So it's different for a lot of people. Some people respond very, very fast and very well. And some people may need a couple treatments. So spaced about 4 to 6 weeks apart, you can come in and get another treatment. And then you might be good for a year or 2 years. So you can maintain that as much as you want.
Love it. Awesome. So again, just one more quick thing about PRP. PRP is really all about the number of platelets that you use. So when we're doing PRP hair treatment, the more platelets that we have, the better it's going to be. And so we use a system that allows us to use up to 15 or 16 milliliters of platelet-rich plasma. There's no other system that allows us to do that. And so again, for our clients and the individuals on this live stream, we're using the best technology to help our patients get the best results. Next is hormone replacement therapy. You know, I started working for a wellness clinic in 2000, so 21 years ago. And one of the things that I started doing was hormone replacement. And hormone replacement in the right patient is magic. Hormone replacement means retreating ladies with estrogen, testosterone, possible progesterone, for men, testosterone. We use pellet insertion, and the nice thing for our patients for that is once that pellet's inserted, if you're a female, you only have to get treated every 3 or 4 months. For men, maybe every 6 or 7 months. So lots of benefits to that. The other thing is, not to get in the weeds with explanation medically, but because it's put into your fat, into your hip, it doesn't have to be metabolized by your liver, which is just a much safer way to do that. So we love using hormone replacement therapy. That's one of those treatments where I'll sit down with you. We'll talk about your goals. We'll talk about lab tests. So your labs obviously have to match somebody who needs that. But for the right patient, and that's a lot of patients that we see, really makes a big benefit. Rory's going to talk about Pdo Thread Lifts.
Yes, one of my favorites. We do use these in combination with fillers sometimes. And instead of using fillers for that volume loss, we will use those Pdo threads to lift and tighten the skin. So sometimes where we see some of those nasolabial folds, some of that jowling that everybody hates, and yes, everybody gets it, and some of this laxity on the skin as well. So we'll use some of those longer shaped threads, which we call barbs, because they're actually shaped like a barbed wire fence, and that's what's holding up that tissue. They are resorbable, so they do dissolve, and you'll get that lasting effect because it is stimulating that collagen.
Yeah, awesome treatment, immediate benefits, and then over time your collagen takes over, so awesome treatment, awesome. The other treatment is a Y-lift. A Y-lift is, as Rory was saying, the thread lifts help with lifting, obviously. Sometimes it's more of a volume problem. And so if we have a patient has a volume problem, the Y-lift might be the way to do that. And the filler that we use on that is Voluma. And again, just showing that we have all kinds of modalities to help our clients get the best results. And so Y-lift, we do quite a few of those. And again, very effective on helping patients look well. Scleral therapy. That's a big word. What does scleral therapy mean?
Scleral therapy is an injection that we use to treat some of those little red spider veins. Those are called telangiectasias, and it's more for cosmetic purposes, which we live in Arizona, so we're all wearing shorts all year round, and so legs is the most common area we treat. And we use the polydolcanol solution, which is an irritant, and so we can close up those veins and make your legs pretty again.
That's awesome. So is it like a one and done with scleral therapy, or how many treatments do you tell your patients it might take?
It'll typically take about 4 to 6 treatments, about a month and a half apart.
Perfect, perfect. Love that. And then one of the things we're really happy to offer our clients, if you can't get that, we really love our clients, and we don't like hurting them. And so Rory talked about doing topical anesthetics. She used that D word, that dental block that we can use to help patients feel a little bit better. And then we also have something called nitrous oxide or laughing gas. And it really does make patients laugh, doesn't it? It's kind of cool. The great thing about nitrous oxide, we've used it hundreds of times here. It's great for certain procedures that take a little bit of time. The patient is in control of that delivery system, and it starts working in 30 to 60 seconds. You might want to remember that for a question coming up. And then when you're through breathing it, it's completely out of your system in about 5 minutes. It really has changed the way we do procedures here. Again, it's not for every procedure that we do, but for the procedures that we use it on, not to overuse the term, but it's a game changer. Really makes a big difference.